How does lactate dehydrogenase affect lymphoma staging? Imagine a tiny enzyme that can tell us a lot about how aggressive a lymphoma might be. That enzyme is called lactate dehydrogenase, or LDH. It's found in nearly all cells of the body and plays a role in energy production. When cells are damaged or destroyed, like in cancer, LDH is released into the bloodstream. This release causes blood levels of LDH to rise, which can give doctors important clues about the disease. In non-Hodgkin lymphoma, especially a type called diffuse large B-cell lymphoma, high LDH levels are a key prognostic factor. This means that if a patient has elevated LDH at diagnosis, it often indicates a larger tumor burden. Basically, more cancer cells are active and causing damage. Because aggressive lymphomas tend to grow quickly and damage more cells, they release more LDH. That's why doctors include LDH measurements in tools like the International Prognostic Index, which helps predict how the disease might progress. While staging in lymphoma mainly depends on imaging tests and biopsies to see how far the cancer has spread, LDH adds another layer of understanding. It helps categorize patients into different risk groups based on how biologically aggressive their disease might be. For example, a patient with limited disease on scans but high LDH levels might be considered higher risk. This is because the elevated LDH suggests the lymphoma is more active and potentially more resistant to treatment. Doctors measure LDH at diagnosis and often during and after treatment. If LDH levels go up during follow-up, it could be an early sign that the disease is returning, even before symptoms or scans show changes. However, high LDH isn't exclusive to lymphoma. Conditions like infections, liver problems, or muscle injuries can also raise LDH levels. So, doctors interpret LDH results alongside other tests, symptoms, and imaging to get the full picture. It's important to remember that while high LDH can mean a more aggressive disease, it doesn't determine the outcome on its own. Some patients with high LDH respond well to treatment, and others with normal levels may have more resistant disease. That's why personalized care and ongoing monitoring are essential. In summary, LDH is a valuable marker in non-Hodgkin lymphoma. Elevated levels reflected higher tumor activity and help doctors assess how aggressive the disease might be. Although it's not part of the physical staging process, LDH plays a crucial role in risk assessment and treatment planning. Regular testing of LDH can also help catch relapse early, but always within the context of a comprehensive clinical evaluation. Patients should discuss their individual results with their healthcare team to understand what they mean for their specific situation.